Hi everybody, I'm Jens. I'm here again with my mom, Dr. Carla Demery, with Demery Chiropractic and Nutrition Center. Today we're going to be talking about chiropractic and what the heck is it? Yeah?
Yes.
Yeah. Okay.
One of my favorite subjects.
I can imagine. Okay, so tell me about what exactly chiropractic is.
Jens, that's a big question. What is chiropractic? Let me tell you the basic premise. What we know is that the brain in our body controls everything. It controls how fast our heart beats, it controls the digestive system, it controls hormones. And so there's a big computer in our head, kind of like a powerhouse. And it has cords that go down into our body, and that is how it communicates with the body. And it's a feedback loop. So it tells the organs what to do, but then there's nerves that come from the organs, and it informs the brain what the organs are doing. And it goes through this wonderful spine that's 26 bones long and very mobile. We can do wonderful things. We can twist and bend and combinations of everything. When I watch the Olympics and those wonderful gymnasts are on, their bodies can do some amazing things. But with that mobility comes some instability. And when those joints get out of alignment, they can compress the nerves or the cords coming from the powerhouse down to the organs. And when those nerves are compressed, then the power can't get to them correctly, and pretty soon those organs begin to show signs and symptoms of disease. So what chiropractors do is we find the joints in the spine that are not in the correct alignment and not moving correctly. And then we do what's called a chiropractic adjustment on them and relieve that pressure off of the cords so that the body can speak fully to itself. That twist of the spine or the joints out of alignment, that's what chiropractors call a subluxation. So a subluxation can be very detrimental. And so sometimes you feel pain, and a lot of patients come in to chiropractors because they have pain in their back. But what they find is when we get the pressure off the nerves and the body can self-regulate itself, it can heal itself, and people feel better, they function better, and they're able to adapt to many stresses much better when the power is back on and working at 100%.
So you said that the brain controls the body basically through this intricate system of nerves and tubes like the powerhouse from the brain sending information down to the body, but you also mentioned that when something's out of alignment or that subluxation, you get pressure on nerves. Well, how much pressure is it really? I mean, do we really have to worry about it? What does that really mean for us?
Well, studies were done, Jens, on a nerve. It was stretched across an EEG machine, and they found that a feather's weight, if I took a bird feather off the grass and I put it on the nerve, it diminishes the capacity of that nerve by 60%. And so that's not very much.
Mm-mm.
With a subluxation again is that term that means that it's compressing or irritating the nerve. And how that happens is three different ways. One is physical. That's probably what people are most familiar with. They mowed the lawn, they bent over and picked up a boulder, they were working on their car for 4 hours, and then their muscles got so tight that pulled the joints out of alignment, and that is a physical way that we get the subluxation. The other two are emotional. So when we have emotions, our body goes into the fight and flight mode. So it can be maybe you have many bills and very little money in your bank account. That makes tension. Your daughter is getting married and there's a lot of planning to do. That makes tension. You name it, that's an emotional tension that the shoulders raise up. The body is ready to fight or run, and that emotion can lead to a subluxation. And then the third thing is being toxic, and we're in an environment with Interstate 80 is right next to us. We have pesticides and herbicides that are on our food. We have chemicals that are being introduced to us. For instance, in our water, we have chemicals that are being introduced to us all the time. There's things in the pills that we take. So all of these things are chemical stresses, and again, the body realizes that it's a stress. We go into that fight or flight syndrome, and then the emotions can pull the joints out of alignment, causing subluxation. And again, when the power can't get to the body has trouble adapting to those stresses. So it's important for people to get adjusted often, because we live we live day to day, and all of those stresses, whether they be physical, emotional, or chemical, are with us every day. So me personally, I get adjusted once a week because I am physically working on patients, but also I have those emotions and I have chemicals that I'm dealing with too. So I need to be adjusted so that my power stays on all the time. That way I can run this practice every day.
So we have different stresses, and we know that just a little bit, just a feather's weight on the nerves can cause issues with the signal getting sent. But I mean, okay, I have some back pain. I'm in my 30s. I got some back pain. My knees kind of hurt sometimes in the morning, but like I can deal with it. Is it just the pain that we have to worry about, or what else happens with these subluxations?
So Jens, that's a good question. Pain generally brings people into the chiropractor. You know, they have back pain and that's why they come. But pain is just a symptom. And that symptom generally happens further on in the process, just like a cavity. With a cavity, it's silent for a long time, and then you get pain and you realize something's wrong. So when we have subluxation and the power isn't getting to the organs don't immediately show symptoms. The symptoms will happen further in the future. But for preventative care, what I have the patients do is they come in on a maintenance basis and we check the spine for subluxation, and when we can adjust the subluxation, then the patients don't have symptoms because their power is on and their organs stay healthy.
So the power's on and we stay healthy, and we want preventative care that helps prevent us from having to experience that pain or from those organs not working the way that they're supposed to. But what happens if we're already in that situation? Can that be helped, or are we just kind of like, I've had this subluxation in my back for 10 years and now I'm out of luck?
When a person comes in, the body is able to begin to heal itself. So when we adjust the subluxation and the power turns back on, then the body will monitor the area, begin to heal it. But it's going to take time. So a lot of patients who come in and they've had back pain for 10 and 20 years, you can imagine there's scar tissue, there's callus formation, there is a habitual routine that the nervous system and the muscular skeletal system has used, and it's a poor habit. So we have to change that habit. We have to make new habits, and we have to train the body to stay in that position. So not only are the adjustments exquisitely important, but the body has to have a chance to heal, time to heal, and then the person has to take some initiative and start doing things that help themselves. Exercise, eating well, drinking well. So it's not just a one-sided care process. You have to take care of yourself in order to get the best results.
So my question is how does it know? How does the body know that it needs to send signals or protect itself or do this? What is that driving force?
We have this process in our body, a knowing. Chiropractors and other practitioners of health call it the innate. It is that knowing. When we are first conceived, there's two cells that come together. Those two cells multiply and they begin to form an entire human being. So the nose cells go to the nose, and the ear cells go to the ears, and the heart cells go to the heart. It is that thing, that knowing, that power that allows our body to grow in the right direction. It starts the heart beating. It starts the brain thinking. So that's an innate power. And so what we want to do, again, the power comes from the brain and goes down into the body. We want to have those cords, those nerves, be free of any interference so that innate can go into the body and allow it to heal. You know, when you have a cut, when you get cut and it bleeds, you will notice that pretty soon there's a scab that forms, and then after a week or so, the scab will fall off, and underneath it, you're going to have a totally new arm underneath the cut. Well, what was that process that started that healing? And it's the innate. It's the body's innate ability to heal it.
The innate is what sends these messages through the body to make sure that everything's working well, and we're like staying copacetic, right? And if there's subluxations, then those messages don't get received or they don't get sent back and forth. There's no communication in the body, basically what we're saying. Chiropractic goes through and adjusts these subluxations so that the messages do get through clear. But what's the side effects? Like, I know, I've seen TV, I've seen those commercials that, like, try this new thing, and then there's, like, the disclaimer is longer than the whole commercial was itself, and usually says something, please don't try this if you're allergic to it, right? So what's the side effects with chiropractic? What's the catch?
The innate intelligence, or the power that's in us, is 100% perfect. It knows exactly what to do. And it allows our body to begin to heal itself. And it is self-directed. It wants us to be 100% of what we can be. So by opening up the power, by taking the subluxations off, we're just opening up that 100% potential of what the body can do. So there are no side effects except wonderful health. Now, when somebody gets a chiropractic adjustment, and because perhaps that subluxation has been there for years, sometimes that is a little uncomfortable. And we have to, as I mentioned before, we have to train the body and make muscles stronger to support an area. We might need to stretch muscles so that it doesn't pull an area out of alignment. But once that initial care starts and the body begins to get better and better, then there are no side effects. So there might be a little bit of pain and discomfort at the beginning of your chiropractic care because of the old habits, but once those are overcome, it's nothing but feeling good. So it's just turning on the power, making us 100% of our potential. That's what getting a chiropractic adjustment does. There are no side effects.
Okay, there's no side effects. But do I have to keep coming back once I start? Okay, honestly, I have a few questions. Do I have to keep coming back when I start? Is it going to wear down my joints and make my bones brittle? And are you really cracking my bones, or what's that noise?
In order for our bodies to stay healthy, we have to maintain them. So you have to bathe, hopefully daily, right? That keeps the dirt and the germs, quote unquote germs, away from you. You know, you could put your hand in some things. You don't necessarily want that to go into your mouth. We have to brush our teeth in order to maintain our teeth. Otherwise, those cavities start, and that's because food is stuck in our teeth and it starts wearing away. And we have to drink water in order for our bodies, because our bodies are mostly water. So we have to maintain some things in order to stay healthy. There are subluxations that occur. We talked about the 3 ways: physical, mental, and chemical problems. And those happen to us every day. So if I can keep subluxation free, you can imagine that I'm going to stay as healthy as possible. So do you have to come all the time? No, you don't have to. Do you have to brush your teeth? No, you don't have to. Do you have to drink water? No, you don't have to. But in order for your body to fulfill its full potential, you want to maintain your body. And chiropractic is a way to maintain your body. The other question was that cracking noise. A lot of patients will say, crack me. And they like the feeling of being adjusted, but The cracking noise is there is fluid that surrounds the joint, and it's encapsulated. So there's a capsule, and when we stretch a capsule very quickly, a vacuum is created, and so gases from the tissues go to fill the vacuum, and that makes that noise. Now, for some people, that noise is very satisfying. They think, I got an adjustment. But for other people, it's gross. They don't like it. They don't like the sound of popping knuckles and so forth. And it's just a result of being adjusted. Now, every time that you get adjusted, you don't necessarily hear that cracking noise, but we're getting the joints functioning at 100%. So whether or not you hear the cracking, if you're getting an impulse delivered into a joint, then it's making some pressure and movement on the joint, and that is taking the pressure off the nerves and working at 100%. So you don't have to have chiropractic care, only if you want to feel better and stay healthier, and the noise can happen. But with chiropractic, there are many different techniques, and I've been practicing for 30 years, and I know there are some people that do not like their heads to be twisted or their necks to be adjusted. So we have instruments that are very measured using a spring. One is called the activator, one is called the arthrostem, and we can use those for people who are uncomfortable getting the manual adjustments, especially on the neck.
Basically, I'm going to be okay, mostly better off getting chiropractic care. Only real side effect is, okay, at the beginning you got to retrain the body, but the real side effect is health. So, if I'm a patient or a potential patient or someone who's like, this sounds super interesting, I want to go see a chiropractor, what are some things that they should be looking for in their chiropractor? What are some, I guess, best practices?
Well, initially, when somebody comes to the chiropractor, they're going to have to fill out paperwork just like you would any other doctor, because we need to know what your history is, what the history of your body is. And so we're going to have you fill out paperwork regarding your health history and even your mental and emotional history. Are you married? Are you divorced? Are you at a job that's super high stress? We need to know all those in order to take care of you better. Then we'll do a history, a verbal history with you, and ask more questions and do a thorough consultation. Because things that you don't think might affect you, for instance, I had a patient who, when she was 12 years old, she had a horse, and she went to go kiss the horse on the nose, and when she went down to kiss the horse raised up and clonked her underneath her neck and threw her about 10 feet back. Well, she came into me with neck pain 40 years later. So that incident with the horse was an important incident because it could have started a habitual subluxation, nerve and muscular response to that big jar. And so we're going to ask questions in order to get information from you so that we can treat you better. After that, we do a thorough examination, and we check your heart, your weight, your blood pressure. We check how the bones can move, if your neck is freely moving, if your back is freely moving, your knees, your elbows, your wrists, your feet. We check everything to make sure everything is moving correctly. We focus, however, on the spine because that is where the spinal cord is housed. And so the spinal cord is the bottom of the brain. It's the brain and how that power comes out through the spine and through the spinal nerves to the organs. So we focus on the spine, but we check everything. Then after we do an examination, sometimes I will do a massage. For me, massage helps me feel the spine and the muscles surrounding the spine a lot better. So I do a massage in order for me to gain more understanding about how your body is working. After we do the examination, then what I do is I call you back and I do a report of your findings. So So everything that I found in the examination, I'm going to explain to you. I'm going to explain how chiropractic can work. I'm going to tell you how long it's going to take to correct that, and then I'm going to tell you how much it would cost. So you have all the information that you need to make a good decision on if you want to go further with chiropractic care. One thing about Desmarais Chiropractic, more than one thing, but Desmarais Chiropractic, we are here to treat you and your family for the rest of your life. So we're going to treat you like family here. And my staff is a very loving staff. They love to see the patients come in, and we do make relationships because we do see the patients very often, and we enjoy that. So when you're here, you're going to be part of the family. The staff will treat you with kindness. We're enthusiastic about chiropractic. We know how well it works to treat people's health. Some of the things that you get here with your care is you have, I do massage for most of the patients before they get an adjustment because it helps me again feel where the subluxations are. I do massages for about 5 minutes, but we also have a massage therapist on staff, both a male and female. They come in and they can do an hour-long massage for you before you get adjusted, which I think helps prepare tight muscles and loosens them up so we can get a very good adjustment and take the pressure off the nerves. We have interferential current here, and that's a physiotherapy that uses electricity in order to help calm down the muscles for pain control and also to speed the healing process. We have massagers that are handheld. They're called a thumper, and then arthrostim is actually an adjustment tool that we use. I stretch my patients. We take time to do stretching in the low back, in the shoulders, and in the neck in order to help the muscles gain and regain their strength and elasticity. So that's available here. The other thing that I've brought into the practice is nutrition. And I find that when somebody needs nutrition, they're going to have signs and symptoms as well. So if we can add more nutrition, better nutrition to them, they get better faster as well. So those are the things that we offer at Desmarais Chiropractic. We love our patients. We want to give them the best care possible, and this is the means that we do it.
Wow, we learned a lot today.
Yeah.
We learned all about what chiropractic is, what it does, kind of how the body works, the signals getting sent back and forth with the innate, that the brain is the powerhouse and it's sending messages all over, and if it's not getting the messages, then the organs aren't working with ease and there's pain. And wow, I just this was amazing. This was a big video. I learned a lot. I hope you guys learned a lot. If you guys have any questions, if there's anything that you want to know about, what are you guys interested in, please let us know. If you enjoyed this, or you know somebody who did enjoy this, give us a like, give us a share, write us a comment. We love to see them all. Is there anything you want to say, Doc?
Well, I can't think of anything in particular, but I look forward to seeing you all, and thank you for watching.
All right. Bye, guys.
Bye.